Hi guys, welcome back to Dr. AI YouTube channel. In this video, we are going to talk about axillary lymph drainage. So in this diagram, here you can see the axillary artery and this is the lateral thoracic artery and this is the subscapular artery. First I'll name the parts of the diagram. So this is humerus and this is scapula, clavicle, and here you can see the first rib. We know that axillary artery is divided into three parts by this pectoral minor muscle. So this is teres major muscle. So the axillary lymph nodes are divided into 5 groups as pectoral, subscapular, lateral, central and apical. So here you can see the pectoral lymph nodes, the first group, pectoral, or we also call it as anterior lymph nodes. So this is the first group. As you can see here, these pectoral lymph nodes are situated along the lateral thoracic artery and behind the pectoralis major muscle and also along the lower border of this pectoralis minor muscle. Okay. So this is the pec minor muscle. So this lymph nodes group drain lymph from the anterior upper half of trunk and from most part of the breast. So this first group of lymph nodes drain lymph from the anterior upper half of trunk and most part of the breast. So now let's move to the second lymph node group, that is subscapular, that means posterior group. Here you can see the subscapular or posterior lymph node group. Here you can see they are along this subscapular artery. And these lymph nodes drain lymph from the posterior upper half of trunk and axillary tail of breast. Now let's move to the third one, that is lateral or humeral lymph node group. So here you can see the lateral group. This is the third group. So this group is present in the upper part of humerus and this drain lymph from the upper limb. Now let's move to the fourth group of lymph nodes, that is central group. So this central group lies centrally and in the upper part of axilla. So this group drains lymph from the other parts and then it drains into this group. So now let's go to the last group. Here you can see it. This is the apical, that means the infraclavicular group. So this is the fifth group and this group is deep to the clavipectoral fascia and it's situated in the apex of axilla along the axillary vein. So this group is very important as it directly drains lymph from the upper limb and indirectly it drains lymph from this central group. So after this central group drains lymph from the other parts, it drains into this apical group. And the direct way is from the upper limb. So that's very important. So that's all about this lymph drainage. Thank you guys.